Hello, welcome to a new episode of our EuroHealth podcast. My name is Jan Klusáček, and our guest today is a Czech member of the European Parliament for ANO, which is part of the Renew Europe group. He's serving his first term in the European Parliament. Before that, he worked as a quality manager at a Czech pharmaceutical company. Welcome, Mr. Knotek. Welcome. Thank you.
Thank you for the invitation. Good afternoon.
Well, you became a member of the Special Committee on Beating Cancer in 2020. So could you please start with a brief introduction what actually this committee does?
Yes, indeed. Cancer is a serious issue, and the European Commission, the von der Leyen Commission, clearly outlined that this will be a priority. And also the commissioner in charge for public health, Stella Kyriakides, presented the Commission European Beating Cancer Plan. And as it is usual, the European Parliament takes action either prior to the Commission or post, in this case post. And as it is a very complex topic going over different policies, there has been a decision by the Bureau, by the Presidency of the European Parliament, to settle standalone, provisionary, not forever, but with one-year mandate, standalone committee for beating cancer, where I have the pleasure to be a member.
The committee is discussing several important topics such as prevention, diagnosis, treatment, and follow-up care. What are current topics, or what are current issues that you are discussing in this final phase of discussion?
Actually, as you say, it is a final phase today. So. It would be good to describe what has been before. So it has been exchange among all possible stakeholders. These have been very rich debates from industries, patient organizations, hospitals representatives, doctors, etc. And after these exchanges, which has taken almost 1 year. The reporter of this report for the beating cancer presented the final report as a proposal. And now we are in negotiations on compromising amendments. And I would say last polishing of the concrete topics. And next week, the final report is expected to be voted in the committee, and in case it passes, I believe so, then the full plenary of the European Parliament is expected to vote it probably January, maybe under some conditions in December. Of course, based on this report, because the followers may ask, okay, you have a report, and what's next? So this is in order to enhance the European Commission to put forward planned legislation changes and incorporate also the ideas coming from European Parliament as a body representing the EU citizens.
And what were your personal priorities in these discussions?
My personal priority has been a balanced approach. And I have brought, I would say, two specific topics. I have not been alone bringing those, but these have been mine two topics. And I'm talking about the advanced therapies, transformative therapies, which are, let's say, high-tech modern therapies and can treat some parts of rare cancers, for example, rare blood cancers, and they are very costly. They are in the research and development phase, and future application could help, but the EU health space is not ready for them. And the second topic was to have a so-called holistic approach patient-centric approach, that everything which can help in each and every stages of the cancer disease shall be applied. So, for example, I can say one example. I'm talking also about homeopathics, or, for example, Chinese medicine. I'm not. I don't want to say that I'm a concrete fan of those medicines, but based on the exchanges of views, I am fully convinced that if a patient is being treated, for example, by chemotherapy, of course, this is the key factor which helps to tackle the disease, but can have a specific, this treatment can have specific side effects. For example, not good sleeping or digesting issues, and also such, let's say, parallel care can help. And of course, it is almost on individual basis. So this holistic, patient-centric approach, combining different levels and layers of medicine, shall be, in my eyes, applied.
And what were the priorities of your political group, Renew Europe? Did it adopt a different approach than, let's say, EPP or SD?
To be honest, I don't think there has been too many differences. Also in our group, the main reporter is from our group, the French MEP Véronique Trillet-Noir, who is, I would say, one of the experts of Emmanuel Macron for health aspect. And we wanted to focus on all basic possible phases. So we have the prevention, which is key, because you can prevent, according to the figures, you can prevent almost half, or at least 40% of cancer can be prevented. Also, the detection. This is absolutely crucial. And there are also two pillars, and this is equal access to the healthcare, because there are differences among EU regions. I have seen one figure up to 20% difference in the access. And the fourth priority is the most set one, but also that means the living with the disease or post-treatment situations, and also palliative care. But also they are part of the life of the cancer life cycle and must be taken care. So I said that I wanted a balanced report, and I would say that many of my colleagues, even among the group, share this approach, including the main reporter. And of course, there can be individual differences. For example, in the prevention, we can touch the most hot topics, for example, linked with alcohol or cigarettes. But at the end, I would say we are going with quite united and balanced approach, which is important.
Well, as I understand, there were some disagreements, especially on topics of tobacco and alcohol prevention. Could you somehow elaborate why was just this topic so controversial?
Actually, to my information, more than half of the time of negotiations was linked with those two factors. It's clear when we start with the cigarettes or with the smoking itself. There is a clear aim to create a tobacco-free generation, and of course, on one side are the related costs, health risk. On the other side is also kind of free way of living, and you have politicians who prefer, let's say, individual decision by the individual, by the citizen, and there are those who prefer systematic protection. And of course, we must find a balance. When it comes to those tobacco or nicotine products, there is a plenty of them. We can start with individual standard cigarettes, which are considered to be most risky and are considered to be phased out. But we can reduce the risk with different tobaccos, different products like heated tobacco products, or then you have the nicotine products who doesn't contain tobacco. And we asked the Commission to assess in the future legislation to apply this risk management based on the data, which must be, let's say, scientifically set and available based on the science. Apply this risk management and with one accent. And this is also the same for alcohol. This accent is to let's say, prevent young people to start smoking. So even, for example, the nicotine products who are probably, and I say probably, I'm not the scientist, really less harmful than, for example, tobacco products. We want to prevent young people who can be under influence of the team or of some environment to start smoking even the nicotine products.
So do you agree with the opinion of your already mentioned colleague Véronique Trier-Lenoir, who said recently that the idea of reducing risks is the vision which is more progressive in nature and more pragmatic? So is this use of alternative tobacco products, at least as a, let's say, bridge solution towards future tobacco-free society, is it better in your view?
Absolutely, I share this opinion. I also stated it in my contribution in one of the committee debates. Of course, it's based on the risk, which is expected starting from the cigarettes to the less harmful. It's a way how someone can stop smoking. That's doesn't stop from one day to another, but say switches to less harmful product and at the end stop smoking. So yes, this is a possible path.
Yet there were quite intensive discussion on flavors in electronic cigarettes and heated products, and especially in relation to minors. So what is to be expected in the final report? Yes,
the correct expression is characterizing flavors. This is about the taste.
Yep.
And for the tobacco products, the direction is heading to full stop of characterizing flavors, and for the novel products like nicotine products, means non-tobacco products, at least on stopping those that could be for the minors, for the young people, like motivation for starting. Okay, it tastes like something sweet. So, for example, I like it, I continue. So for the nicotine products, at least the most attractive for the young people, and for tobacco products for characterizing flavors. At least this is my reading of the most recent development. Of course, the final vote is the final vote, so we are not yet there.
Yes, you mentioned there is expected to be final vote in the committee next week, and in 2022 there will be vote of the whole European Parliament. So do you believe that this report will directly influence lives of European citizens?
Not from day to day, but starting 22 till, let's say, 24, European Commission is in charge to propose concrete legislation, because the report, maybe it's good to explain for the followers, the report is not a legislative act. It is opinion of European Parliament. And of course, it is one of the valuable inputs for European Commission, who triggers the concrete legislative proposals. And of course, these legislative proposals are then being also co-voted and co-approved by European Parliament. So such a report is a good input for European Commission. Let's say what should not be forgotten, what should be in, and also where the majority in the European Parliament is situated in order to have support for the legislation that the European Commission put forward.
And maybe could you provide some specific examples of actions that are expected from European Commission?
Yes. So, for example, when we have been debating this tobacco and alcohol, so we are talking about the taxation of those products. This is one of the concrete legislation. We are talking. Then I jump the topic. There is in parallel with other strategies, and not leaving the question, but maybe good to explain. Let's say that the Beating Cancer Plan is a strategy on cancer. But at the same time, we have a pharmaceutical strategy, we have an industrial strategy, and also those contain some measures. And these measures could be also then applicable for example, beating cancer. So I'm talking, for example, for the European health data space, which is a tool which can help share the best practice and also share the patient's data on considering cancer on a voluntary basis to, for example, reduce the disparities in the treatment among the member states. So, for example, such concrete examples.
Thank you. And do you think that the final report will have relevance even to Czech presidency, or is it like too soon to expect any specific actions?
Actually, I am quite positive. It would be a pity if Czech presidency would not have this as one of the topics. I'm even not shy to say a priority. As you know, as the followers probably know, there has been elections, and there is now new government to be designed, and of course they will, let's say, recalibrate some priorities for the presidency from the ending government. So I cannot guarantee, but at least I will do my best to. Because I will be then a so-called opposition MEP. My home party is going to end up in the opposition, but with a strong voice as the strongest party in Czech Republic. And of course, I will do my best to persuade the new government to simply have this topic on the table because it has been the priority of the previous government, and I think we should have a say also because this cancer is in Czech Republic in the percentage higher cause of death than the EU average, and we should profit from all the EU action against the cancer as most as possible.
Okay, thank you so much. Thank you for your time. I think we ended on a rather positive note, so let's keep it that way. So thank you again.
Many thanks for invitation, and have a nice day.
Thank you.